Welcome to this video where we'll be discussing Wilms tumor, a type of kidney cancer that primarily affects children. We'll explore what causes it, how it develops, its symptoms, diagnosis, treatment options, and more. Our goal is to provide a comprehensive overview to help you better understand this condition. The exact cause of Wilms tumor is not fully understood, but it is believed to result from a combination of genetic and environmental factors. It arises from abnormal kidney cells that fail to mature properly during fetal development. Instead of becoming normal kidney tissue, these cells remain in an embryonic state and can eventually become cancerous. Certain genetic mutations have been linked to an increased risk, including mutations in the WT1, T2, and CT and MB1 genes. While these mutations are often spontaneous, meaning they occur randomly, some individuals inherit them from their parents. Certain congenital conditions, like Wegener syndrome, Denys-Drash syndrome, and Beckwith-Wiedemann syndrome, are also associated with a higher likelihood of developing Wilms tumor. Let's delve into the pathophysiology, or how Wilms tumor develops and affects the body. As mentioned earlier, it starts with leftover embryonic cells in the kidneys. These cells, called nephrogenic rests, normally disappear before birth. In those who develop Wilms tumor, these cells persist and can become malignant. As these cancerous cells multiply, they form a tumor within the kidney. This tumor can grow significantly, distorting the kidney's normal structure and function. It can also invade surrounding tissues and organs, such as the renal vein, vena cava, and nearby lymph nodes. In some cases, the cancer cells can spread to distant sites, like the lungs, liver, or brain through a process called metastasis. Wilms tumor is a relatively rare cancer, but is the most common type of kidney cancer in children. It typically affects children between the ages of 2 and 5. It's rare in older children and adults. The incidence rate is about 1 in 10,000 children. There appears to be a slightly higher incidence in African American children compared to Caucasian children. Also, girls are slightly more likely to be affected than boys. While Wilms tumor can occur in both kidneys simultaneously, bilateral Wilms tumor, this is less common, accounting for about 5% of cases. The signs and symptoms of Wilms tumor can vary from child to child. The most common sign is a painless abdominal mass or swelling that can be felt upon examination. Parents often discover this mass while bathing or dressing their child. Other potential symptoms include abdominal pain, blood in the urine, hematuria, high blood pressure, hypertension, loss of appetite, nausea, vomiting, fever, and constipation. In rare cases, the tumor can press on nearby structures, leading to shortness of breath or leg swelling. It's important to note that these symptoms can also be caused by other conditions, so it's crucial to consult a doctor for proper diagnosis. Diagnosing Wilms tumor involves a comprehensive evaluation. The process typically begins with a physical exam and review of the child's medical history. If a doctor suspects Wilms tumor, they will order imaging tests to visualize the kidneys and surrounding tissues. These tests may include abdominal ultrasound, CT scan, or MRI. These scans help determine the size and location of the tumor and whether it has spread to other areas. A urine test may be performed to check for blood in the urine. In most cases, a biopsy, where a small sample of tissue is taken from the tumor, is needed to confirm the diagnosis and determine the specific type of Wilms tumor. The biopsy can be performed before or during surgery to remove the tumor. Wilms tumor is classified based on its histology, or the appearance of the tumor cells under a microscope. The two main types are favorable histology and unfavorable histology. Favorable histology means the tumor cells look relatively normal and are more likely to respond well to treatment. Unfavorable histology, which includes anaplastic Wilms tumor, means the tumor cells look more abnormal and are more aggressive. The type of histology plays a crucial role in determining the treatment approach and prognosis. Additionally, Wilms tumor is staged based on the extent of the cancer. Staging ranges from stage I, where the tumor is confined to the kidney and completely removed, to stage V, where the cancer has spread to both kidneys or distant sites. Treatment for Wilms tumor typically involves a combination of surgery, chemotherapy, and radiation therapy. The specific treatment plan depends on the stage and histology of the tumor, as well as the child's age and overall health. Surgery is usually the first step, aiming to remove as much of the tumor as possible. In some cases, the entire kidney may need to be removed, nephrectomy. Chemotherapy uses powerful drugs to kill cancer cells throughout the body. It is often given before and after surgery to shrink the tumor and prevent it from spreading. Radiation therapy uses high-energy beams to target and destroy cancer cells in a specific area. It may be used in more advanced cases or when the tumor has unfavorable histology. Treatment decisions are made by a multidisciplinary team of specialists, including pediatric oncologists, surgeons, and radiation oncologists. Unfortunately, There is currently no known way to definitively prevent Wilms tumor, as the exact causes are not fully understood. However, genetic counseling may be recommended for families with a history of Wilms tumor or associated genetic syndromes. Regular check-ups with a pediatrician are crucial for early detection of any potential health issues, including abdominal masses. If a child has a known genetic condition associated with an increased risk of Wilms tumor, their doctor may recommend regular screening with abdominal ultrasounds. The prognosis for children with Wilms tumor is generally very good, especially when the cancer is diagnosed at an early stage and treated effectively. The overall survival rate is around 90%, meaning that about 90% of children with Wilms tumor will survive at least 5 years after diagnosis. The prognosis is better for children with favorable histology tumors and those with earlier stage disease. Recent research is focusing on identifying new genetic mutations associated with Wilms tumor, developing more targeted therapies with fewer side effects, and improving our understanding of the long-term effects of treatment. Clinical trials are ongoing to evaluate novel treatment strategies and personalized medicine approaches for children with Wilms tumor. These advancements hold promise for even better outcomes in the future. If you have any questions or concerns about Wilms tumor, please consult with a healthcare professional.